There are lots of things that will cause a foot drop in which it's difficult to dorsiflex the foot. And the differential diagnosis of that is a very useful clinical exercise. So one of the common causes of foot drop is a common peroneal nerve palsy, in which the nerve at the head of the fibula, I'm rolling mine now, I can feel that, is impaired. And this gives you weakness of dorsiflexion and of eversion, whereas inversion and plantarflexion are lovely and strong. You may get some sensory change in this sort of area, and you should have a preserved ankle reflex, like that. If, on the other hand, the problem is caused by a lumbar nerve root matter, so pressure on the lower lumbar upper sacral nerve roots, then you'll have weakness all around the ankle and weakness of knee flexion. And the ankle reflex is absent. There may be limitation of straight leg raising. Then the third cause of a foot drop is a so-called spastic foot drop, in which the legs are spastic. So you have a pattern of weakness in which everything extending and adducting is strong, and the opposite is all weak. But it presents as a foot drop because the foot tends to be held down. And the clue here is that there's increased muscle tone. You flick the leg and the foot comes up rather than staying on the floor. The reflexes are pathologically brisk, and the plantar response is extensor. Leg muscles tend to be strong and hard to overcome even in people who are a bit weak. So a patient with a foot drop, cock your foot up towards your face, keep it there. You may not overcome that even in a patient who's unable to walk on their heels. So the walking on the heels is more sensitive. If the patient has a foot drop, then if it's common peroneal, keep the foot up, that will be weak, and the toe will be weak. Eversion, put the foot there, don't let me push it in. In this patient, it's nice and strong. If it's a lumbosacral root lesion, inversion, turn the foot inwards, would be weak, and plantarflexion and toe curling, push away, point the foot away, would be weak. Testing around the ankle may distinguish common peroneal from lumbosacral nerve root. Quite a useful muscle in that context is hamstring. So bend your knee, don't let me pull it straight. So that's lovely and strong. So her S1 nerve root is working very nicely, thank you. Tendon reflexes, of course, important. So the ankle reflex is a very key one to be diminished in either a peripheral neuropathy or in a lumbosacral radiculopathy. 3 causes of foot drop: common peroneal nerve palsy, lumbosacral radiculopathy, and a spastic foot drop. And they can be quite easily sorted out in 2 minutes at the bedside.